Music for the mind, the science behind singing to help treat symptoms of Parkinson's disease, and the new musical group here in Kansas City that you or a loved one living with Parkinson's may want to join. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. We're talking about music this morning because music can make you feel all sorts of things. Joy, sadness sometimes, nostalgia, excitement, but it can also be used as a therapeutic tool. So this morning, we're talking about how singing can benefit people living with Parkinson's disease. And we have a phenomenal panel for you this morning. I'm so excited for this. Joining us virtually is Pam Sullivan. Pam is a patient who is living with Parkinson's disease. Thank you for being here, Pam. And here in the studio, we have Dr. Lindsay Heydrich. Dr. Heydrich is a speech pathologist, and she works closely with the neurology team and their patients with Parkinson's disease. She's also the clinical director of the Department of Hearing and Speech at KU Med. And we have Dr. Rebecca Lepping. Dr. Lepping is a cognitive neuroscientist and a music psychologist. That's quite a combo. Very interesting. She's also the director of the Power of Music Laboratory in the neurology department. And she is research director for the Human Brain Mapping Program. And we have our very special guest. We're so happy to have her because she was in an airport yesterday at this time. We have Dr. Sunju Lee. Dr. Lee is a professor of music therapy at UMKC, and she's also the director of a really cool musical group called the Tremble Clefs here in Kansas City. It's a musical group for patients living with Parkinson's disease and their spouses or caregivers. She created this group here after creating one in Iowa that is a huge success. We are so happy for this discussion. Thank you all for being here. Before we dive in, first, let's take a look at this story that recently aired on PBS Iowa about Dr. Lee and the Tremble Clefs there.
Look up! I'm here, everyone. There's a bright golden haze on the meadow. The Tremble Clef is a choir for people with Parkinson's disease, caregivers, and family members. Everybody's voice is so awesome, right? Jen, oh, what a beautiful morning.
Oh, what a beautiful morning.
Wow. Parkinson's disease is a neurodegenerative movement disorder that affects motor and non-motor functioning.
I'm alive, awake, alert, enthusiastic. Alive, awake, alert.
More than 70% of people with Parkinson's disease experience some voice and speech-related symptoms.
Enthusiastic. And I'm alive, awake, alert, enthusiastic.
Keep going. They experience some enunciation problems, the reduced volume of speech, and monotone speech.
Alive, awake, alert, enthusiastic.
It's not just simply singing for fun. It's a therapy. There are lots of goals we have to accomplish. Mama, mama, stop. Now we go. Mama, baby, that's my M&M. We are using therapeutic group singing as a major intervention for people with Parkinson's disease. To improve their respiratory, phonatory, and articulatory systems. We're using the lung muscles for breathing. We're using our larynx and vocal cords to produce the sound.
Big exaggerated.
We are using our lips and jaws and the muscles on our face to articulate. In music, there are so many different kinds of elements. We have melody, we have rhythm, we have tempo, and we have expression. So those elements have those people to feel better, think better, move better, and also help them to be connected with others. So music is creating a very positive and safe place for us to communicate. Stop and go. Without the fun aspect, they're not coming back. If they do not come back to the setting, the treatment, therapy, there's no improvement. I really encourage people to consider music therapy for treating people with Parkinson's disease. It's a simple singing group, but it can provide more than that. It just gives them a chance to be more socialized and helping each other so that they can continue their life with Parkinson's disease.
Wow. That is so neat, Dr. Lee. What an incredible gift that you're bringing to Kansas City. Just love watching them. You also did this in addition to Iowa City. You had a group in Arizona.
That's correct.
So how did you make the connection between singing, being able to help patients with Parkinson's disease in all of your studies? When did that connection happen for you?
So my connection between singing and helping Parkinson's disease developed through my background as a classically trained singer and a board-certified music therapist. During my graduate study at Arizona State University, I had an opportunity to work with individuals with Parkinson's disease. I noticed that her voice were not quite there when she's speaking, but after singing, her voice gets louder and then stronger.
Oh, that's so neat.
Then that really sparked my curiosity about using singing as a therapeutic intervention for people with Parkinson's disease, and led me to work with Tremble Clefs, Arizona. Then I've been serving as a music director of Tremble Clefs, and most recently, I established a new one here in Kansas City as a faculty member at UMKC.
That is so fantastic, and everybody looks so happy in that video. Dr. Lepping, you run the Promise Lab, the Power of Music Research Center. In the Power of Music Lab, your research, which you're doing right there with that, that cap, we'll get to that in a minute. What has surprised you most about your studies when it comes to music and neurological diseases?
When I was training as a musician, I thought primarily about music as sound. And the more I learn about neurologic diseases and the brain in general, the more I'm surprised at how pervasive and how much the brain and the body are activated during music. And we saw that in the Dr. Lee's clip.
So you both started out in music first and then went into neurology, or was it a 1-2 comp? I'll start with you. Were you always interested in both? What came first?
I was a double performance major as an undergraduate until I took my required gen ed psychology class, and that got me turned on to the brain.
Okay, and then Dr. Lee, what about you? What came first, music or the neurology and the brain component?
So I came to America to study voice performance. I wanted to become an opera singer. Then I double major in music therapy, and I realized the use of singing can help people with Parkinson's disease for them to improve their voice and brain health.
As you talked about. So Dr. Heydrich, you've been nodding your head. Super exciting to see for people watching at home who don't have medical backgrounds. What is it about Parkinson's disease that affects speech and the way people make their sounds?
That's a great question. So first of all, in Parkinson's disease, it's a loss of dopamine in the brain. And so that loss of dopamine impacts the voice and causes difficulty with speech production. So oftentimes we see that causing an impairment called hypokinetic dysarthria. And what hypo means is a reduction. So we see a reduction in rate control, volume, pitch, and just the ability to have normal prosody as we talk and speak.
When you say dopamine, Not having a medical background, I always associated dopamine with happiness or sadness.
Yeah, that's a great point. And yes, those are features of it, but importantly in Parkinson's, it's movement.
Okay.
Right. So, as Dr. Lee mentioned earlier, we see non-movement and movement symptoms with the disease. Oftentimes, as a speech therapist, it's hard for me because I always think, you know what? There's movement, a lot of movement in speech. And as I was watching that clip, the biggest takeaway I saw was the movement that you saw in the face.
Yeah.
And I don't know if anybody goes back and rewinds, but they should, because you can see how much more movement those individuals had as they started singing and continued to sing. And that's one of the things we see in Parkinson's is that reduction in facial movement.
Yes.
So it's really, I mean, just such a fun and functional way to work on speech and voice.
And have a good time.
Absolutely.
I want to bring Pam Sullivan in because Pam is our guest who happens to be living with Parkinson's disease. Pam, how long ago were you first diagnosed?
My first diagnosis was in 2019. No, 2012, sorry.
Okay, 2012.
2012. So I've been living with Parkinson's a while. Go ahead.
What I was going to ask you, what are some of the biggest challenges that you face at the stage you're at right now?
Well, fortunately, I have a new drug that has been wonderful in controlling tremor. That was my primary and most annoying symptom. So I'm fortunate that I don't have larger movement issues right now. But I also noticed that I am proving the quip that says half of marriage or 90% of marriage is yelling what from the other room. And I suspect that that's due to Parkinson's, not due to my husband's lack of hearing, which is what I wanted it to be.
Right. You never know. You can always still give some of the blame to him. Pam, can you share some of the therapies that do help with the symptoms you have? And do any of your symptoms involve your voice?
I would have said no probably 2 months ago. But as a participant in the study, that's one of the questions I get from Dr. Lyons every visit is, are you noticing that your voice is quieter? Are people having trouble understanding you? And just recently, I'm creating a series of audio tapes for my grandson who's in Arizona. And I've noticed that it's more difficult to do different voices and to make those voices expressive.
Okay. You mentioned a study, so you're in a clinical trial or study right now?
It's ending at the end of March, but yes, I
love
am.
Hearing that.
Yes, it's been a drug study, and right.
Okay. And how old is your grandson? Is this like a memoir, or are you reading stories to him?
Right now, I'm reading Mary Poppins, and he's 7.
I love that. So
and I was really touched. He took my reading of Mary Poppins was the only thing he took to listen to on a trip that they recently took as a family. So very touching for me.
That makes me want to cry. That's so sweet. Pam, after learning about the Tremble Clefs, what are your thoughts on how that could benefit you? Is that something that you and your husband might want to try?
Maybe my husband, maybe a friend of mine. All the people I know claim that they can't sing, but I don't think that's a big deal for the Tremble Clefs.
Dr. Lee, is it a big deal if you're not a singer, a trained singer in the Tremble Clefs?
I don't think so. Tremble Clef is designed to help everybody to participate with or without any musical background.
We actually have a link to put up on our screen right now, or some information, because Dr. Lee, you've partnered with Turning Point here at the health system to launch the Tremble Clefs here in Kansas City. We're just so grateful for this. So tell us about the information we're putting up and how someone goes about joining if they're interested.
So we have been offering our program since last February. We meet every Wednesday from 10:30 to noon at Turning Point. Anyone interested in joining can visit the Turning Point website or contact me directly. Also, they can visit the Tremble Clef Arizona website to learn more about the program, especially the benefit for therapeutic group singing for individuals living with Parkinson's disease.
Because it's just getting launched here. And already we have some questions and comments that are coming in from our viewers. So if you have anything you'd like us to share or read out loud on the program, you can send it to us right now on YouTube or Facebook. The links on how you can connect with us in real time are right there on your screen. How do you adapt the program, Dr. Lee, for patients who are coming in at different stages of the disease?
Right. I just talked to Pam. Our program is designed to help any people with Parkinson's disease at any stage, because we use familiar songs, and the motivating nature of group singing help the participants to enjoy the music in therapeutic way. And also we define our success, the engagement of the program, so people can come and join us with any stages.
One of the things that's really important to you, Dr. Lee, is you said the spouse has a specific role in this group. It's not just a spouse bringing their loved one with Parkinson's and dropping them off. So how important is it, and what role does the spouse have?
So the spouse and caregivers can participate in our program as an equal partner. They're not just coming there to help their loved one to sing. They involve and they participate in the program as an equal partner, and they share the music experience and help us to bring the community as more supportive and more engaging for everybody.
So for that period of time, it's not a caregiver-patient relationship, it's partners, which is what the marriage ideally started out as.
That's correct.
As a partnership. Pam, does that resonate with you, the idea of bringing back the partnership dynamic rather than patient-caregiver?
I think that's maybe one of the primary differences between sort of professional caregivers and family caregivers, is that the family, is doing it out of love and a sense of, your relationship as a whole, whereas sometimes when you have another person doing the caregiving, it's not so personal. Not that caregivers don't all care, but it's a different kind of caring.
Sure.
So, and for my husband specifically to be able to sing, I think would involve a sacrifice of his self-identity as a non-singer. I think he'd be pretty embarrassed by having to sing.
Well, we got to get him out there and see what happens. I was just telling Dr. Lepping and Dr. Lee, I would be so nervous if you put me in front of a group to sing. I'd much rather sing in a group rather than singing in front and performing, as you both have done. Beyond the physical effects of the Parkinson's disease, Pam, what have the interpersonal adjustments in relationships that you've had to navigate since your diagnosis?
Well, probably the first thing, and I have talked about this on another program, so I'll just touch on it, that with a tremor in my right hand, and I'm right-handed, I think it was very visible, and that was what I had to deal with first, is how do you present yourself to the world as a person with Parkinson's without saying, oh yeah, I'm just a disabled person.
Mm-hmm. Because you didn't want that to be your identity, and it's not your identity.
Right.
It's something you happen to have.
It's a condition I am dealing with. So
that's important.
I think that was the main thing. What other kinds of things have I had to negotiate? Well, I worked until recently, so I had some adaptive tools in order to be able to use my computer effectively, even because the study has not been going on since I was diagnosed, so I've only recently had relief from the symptoms. Mm-hmm. So I think it's a combination: embarrassment, public image, your own self-image. Are you going to let Parkinson's define you or not?
That's so important, and that's so important to recognize when anyone is with someone who happens to have Parkinson's, is it's not their identity. Mm-hmm. Dr. Heydrich, as a speech pathologist, when you compare singing in a choir, let's say, to one of your patients talking at a gathering, what is the difference in the muscles being used?
That's a great question. So oftentimes when we're singing, right, we are using more of a maximum phonation, how long we can hold a sound, or pitch ranges. We're not going to walk into a party and say, hello, how are you?
I am here.
Yeah.
Right.
We don't do that. But there is still importance with stretching those muscles to their maximum, and using our vocal cords in a way that helps them vibrate and stretch more. And singing kind of is able to elicit that in a really great way that is fun.
Is it a use it or lose it kind of thing?
I was actually going to say that's the number one thing I think if you come to KU that you will hear from every provider in Parkinson's clinic is we always say this is a disease of use it or lose it. If you don't use it, you'll lose it. And find ways to use those skills. So be that exercise, support groups where you're talking, singing groups, individual therapy. You really have to use those skills. Otherwise, unfortunately, that system will become more rigid and we'll lose a lot of those skills. So absolutely.
Oh, we hear that from every specialist, every doctor. The cardiologist will say right after open heart surgery, they say, get up and walk, use it or lose it. Dr. Lepping, when it comes to the brain processing the music versus speech, music versus speech, what are the differences in processing that?
Well, I think Dr. Lee mentioned them earlier. You've got melody and rhythm that are important in music and also important in speech, but less, excuse me, less prescribed.
Okay.
So I can say the same sentence to you with prosody, but it doesn't have that range that you might have in the pitches. And then I could also say the same sentence quickly, or I could say it very slowly and deliberately. That gives information in communication through speech, but that's sort of packaged in the musical experience.
Okay. Speaking of music, before we get to the community questions, Dr. Lee was teaching us some things to do if you're nervous before something, like if you're watching this and you have a big presentation, it was some sort of vocal exercise of, right? What's that called? Can you do it? It's like trilling? Sounds like a bird.
It is called lip trill.
Lip trill?
It's a part of semi-occluded vocal tract exercises. So we can use lip trill, humming, and raspberries, and also we can use kazoo. It's a fun instrument, and also we can use straw.
What is it about the trilling that can make you less nervous or loosen you up? Because I never knew this when I was growing up, or even when I was first auditioning for jobs in broadcasting. If I had gone, what would that have done for me?
So it is helping us to connect our breath to vibrate our vocal cords more efficiently in a more relaxed manner.
Okay.
So it will really help us to warm up our voice and be ready to speak.
Okay, so if you hear anyone in your house doing that, at any point, they're not bird calling, they're trilling. We have some questions coming in from our community, so I want to get to those right out of the gate. Janet wants to know, this is a good one, can you ask Dr. Lee how she measures success for participants? How does she know it's working?
Right. In Tremble Clefs, we use various ways to monitor the therapeutic improvement of group singing. We collect voice samples, and also we use clinical assessment to measure the changes in voice, mood, and the quality of life.
Question from Jean Reardon. Jean wants to know, and I'll direct this one to Dr. Heydrich. Well, actually, I could ask all three of you. Does this help? Does singing help with swallowing? I know that it's very important because my brother had Parkinson's. Who wants to take that question?
I can take that question,
okay.
Absolutely. So that's a great question as far as the mechanism that is involved with both speech, singing, and swallowing. So when we swallow, one of the key features we have to have is vocal cord closure. And when we do activities like singing or in speech therapy, we're working on vocal cord, what we call abduction and adduction, those vocal cords coming together. Well, Parkinson's oftentimes will cause some rigidity of that structure. And so when we hear a person, we might hear more hoarseness or raspiness or breathiness of their voice. Well, that's because their vocal cords aren't making contact like they should. So if we work on things where we really work on those cords coming together efficiently, we can help protect that airway as we swallow too. And actually the research is so interesting in this area, I think, because when they first started looking at therapies specifically for Parkinson's disease and voice, that wasn't an outcome that they were even thinking about. And then patients, just like the person online mentioned, started saying, yes, we're noticing this change in swallow function. So that's a really great thought to ask, because there's been some confirmation of that.
Recently, I had to see a speech therapist I was really hoarse all the time from allergies and asthma and things, and she had me do this exercise. My husband thought it was creepy because I was walking around the house going, "Who is Sue? Who is Sue?" I mean, it's kind of weird. Why is that so helpful then? Because it actually helped me get less raspy.
It's a lot of what Dr. Lee said earlier about when we're easing into that voicing, we're not making such hard contact. A lot of our inclination, right, is to overshoot it and to go too far. And then we elicit strain and we elicit tightness of the voice. And by doing what you were just talking about, is you're easing into that voice, allowing that voice to be more relaxed.
Dr. Lepping, Gretchen has a question, and I want to take this one to you. She wants to know, what is it that you see in the Promise Lab that shows that singing engages the brain differently? And I think you talked about this, but are you looking at like a computer screen? How do you know? We saw the video of the guy with the cap on, right? So what is that measuring then?
So the cap is measuring electrical signals from your neurons when your neurons fire. That is producing a measurable electrical signal. And what we are doing is setting up experimental designs where we have different conditions. So in this case, what you're seeing on the screen, someone is listening to live music.
And they have the caps on in the
with the caps on in the background. And we'll compare that to another condition that isn't music. So maybe they're listening to speech. And we can compare the electrical activity that's happening across the brain in these different conditions. And that gives us some insight into what's different between music versus other sorts of things like speech.
Dr. Lee, Marie wrote something nice. She wrote, "I love this whole discussion. What kinds of changes has Dr. Lee noticed the day after or after the first time someone and their partner join?"
Right, they usually say, "I feel much better with my voice. My voice is louder." And especially caregivers said that, "I can hear what my husband say finally." And then they're encouraging their husband to come back so that they can keep on exercising their voice in a friendly and fun environment.
Oh, okay. So there we go. We have Pam. Pam, what do you think about that? Your husband, you might not have to bicker about if is his hearing going or if you're not projecting.
I think that sounds great. And I'm interested in this in another aspect too, but maybe Dr. Lee will see me in one of her sessions. Maybe then my husband will come. But it's very intriguing.
Mary has a question about speech therapy, Dr. Heydrich. She wants to know if singing plays a role in the speech therapy that you do with your patients.
Well, I focus much more on conversational speech, honestly, and individual therapy. So no, I'm not doing much of the singing, although some of the semi-occluded vocal tract exercises we talked about earlier, the lip buzzes, the straw work, yes. Okay. Really what I'm trying to achieve in individual therapy is taking a task that the patient does every day in their everyday life and make that part of therapy. So I'm working with patients on getting that voice louder and then carrying that over to a simulated activity like, you know, we'll practice ordering coffee at a coffee shop or reading a book to a grandchild. And we will work on recording those, listening back, changing it up if we need to, making the voice louder, maybe making more inflection as somebody is reading. Those kind of tasks is what I work on a lot with patients.
This is a great discussion, and I'm just so happy that you could all join this morning, and including Pam. Thank you. For today's takeaways, I want to start with Dr. Lepping. Dr. Lepping, where do you see your research headed next?
So we actually are working on some grant proposals for this project to see what is happening in the brain with Dr. Lee's Tremble Clefs, with the program to see where, whether this is increasing dopamine activity in the brain and addressing symptoms, or whether this is leading to neuroplasticity and changes in the brain. So we're very excited about getting started with this program here in Kansas City.
That's going to be very interesting to see how that goes. Dr. Lee, when it comes to engaging the brain with singing versus speaking, what do you want our viewers to take away from this?
I want to say singing used lots of same elements for speaking, but singing is a multitasking activity. When we are engaged in singing, we activate the whole brain, including the brain part for mood, emotion, movement, and cognition. So why don't we take music and singing as a way to exercise our brain and improve our voice, ultimately enhancing our quality of life?
Music as medicine. Dr. Heydrich, there are people watching right now who are recently diagnosed with Parkinson's, or they may have someone they love very much that's been diagnosed with Parkinson's disease. What do they need to know moving forward?
I think Pam actually put it really well earlier when she said that I don't want to be just identified as having Parkinson's disease. I feel like the biggest kind of rallying cry I tell my patients when I see them and they're newly diagnosed is, look at your medical team as your kind of group of assistant coaches, right? We are there to give you our experience. We'll help you understand the research about the disease, but ultimately, we want to empower you to make the best decisions for how you want to conquer this and how you want to address the disease. And engagement's the way to do it. You know, stay engaged, stay active is really what I try to cheerlead my patients to consider as they start this journey.
That's why we're so grateful for Pam Sullivan at home. Pam, thank you for engaging with us and sharing just a little bit about your experience. What's the biggest takeaway that you want people to know about living with Parkinson's?
Wow. That there are many ways to attack an issue, and that if something doesn't work the first time, keep at it, because maybe you'll find something else that does work. And not to be discouraged by the fact that it's a degenerative, a progressive disease, but to be prepared to face those challenges and to know that everybody's different.
Everybody's different. Doesn't define,
Right.
there's not one definition that fits all.
Right.
Thank you, Pam. And one
You're
final
welcome.
note on this program, we want to say happy 25th birthday to the University of Kansas Health System's Turning Point. The Tremble Clefs is just one terrific program out of many that Turning Point offers. So I want to put up that information one more time. If you want to check out the website or join the Tremble Clefs, just go to turningpointkc.org. Thank you so much to our guests for coming here and sharing your expertise. And thank you to our viewers for joining the conversation. Coming up tomorrow morning at 8 a.m., it's open mics. And it's a brand new high-tech clinic on wheels designed to bring cancer screening straight to the communities and people who need them most. So you'll get a first look at the Masonic Cancer Alliance mobile screening bus tomorrow at 8 a.m.